The one thing about Providence Healthcare is I know we're gonna make this work. We've got all sorts of booths set up so that you can walk through, talk to the experts, get your questions asked. Let's roll up our sleeves. Let's have a little bit of fun today, but roll up those sleeves and let's get her done in 81 days.
Today I'm here at the World Café with the Learning Team booth. We'll be helping educate staff that are dropping by our booth about what the Learning Team does and our place in sort of the learner's journey and how we help staff get ready for going live with CST.
I'm here representing the Department of Professional Practice, who have been responsible for leading the education regarding practice changes that will come as a part of CST. Many of these practice changes come because we're having a change in terms of an electronic health record. Some of them are coming because we have the opportunity to actually improve our practice and our care of patients.
We do additional privacy module for all clinicians and providers to access Cerner. This governs the relationship that clinicians have with every patient and how they are able to view their private information.
CUTOVER is about taking your chart, so be it electronic or paper, in your system today, and cutting that over or taking the information out of your current chart and transcribing it into your new CST system, which will be going live on November 16th.
Two of the main ones that you're going to see at World Café today is Patients in Transition activity, which is kind of like a first look for key people at the site to get a chance to have hands-on keys and start to think, oh, this is how my future is going to be. The other activity that we're running is the workflow reviews. We're coming up and we are going to be talking about the strategy and how which we educate peer mentors who will then educate the general user on what their future state workflows are going to look like.
So today at the provider station, we're going to be showing physicians and other providers a look at the Cerner power chart system for CST. We'll be looking at things like order entry, documentation, the message center. In addition, we'll be demonstrating front-end speech recognition and talking about the learning journey that we're planning for providers for CST.
The Peer Mentor program is a team that we're putting together in order to support the implementation of CST at Providence Healthcare. Peer mentors are clinical team members from all disciplines: nursing, allied, pharmacy, medical imaging. So team members from all across our programs and sites that will come together to be the first team to learn the new system, that will really support their colleagues during the training and adoption period, and then transition to elbow support at the time of go live.
If you ask them if they want to go back to paper, they absolutely emphatically say no. We get to see the whole patient picture all the time, and we can just look after our patients much better. I think it's awesome to see all the interest. I can see the nerves just like we had, but it's great to be able to reassure them that we went through it and it went amazingly well, and that to just assure them that it doesn't always have to be perfect because there's always a lot of people to help.